Hello everybody, I am Dr. Guido Giordano, medical oncologist from San Filippo Neri Hospital in Rome, in Italy. And I'm here to present you the Italian real-life experience performed on a national database about the impact of the adjuvant treatment in patients who had received then first-line Nab-paclitaxel plus gemcitabine during metastatic setting. Nowadays, we know that adjuvant treatment standards of care are represented by gemcitabine or fluoropyrimidines, or following the results of the ASPAC4 study, combination of gemcitabine and capecitabine. But majority of patients who receive an adjuvant treatment relapse with distant metastasis or local recurrence. And in our experience, we have analyzed 400 patients who had received gemcitabine plus Nab-paclitaxel after relapsing during adjuvant treatment. In our database, 27% of patients had relapse after the adjuvant treatment, and in the whole population, the adjuvant chemotherapy was an independent prognostic factor related to longer survival and long progression-free survival. In our analysis, looking at the population who received an adjuvant treatment and then Nab-paclitaxel plus gemcitabine first-line chemotherapy, we observed that the disease-free survival interval during the adjuvant chemotherapy was prognostic of outcome in the metastatic setting. In fact, a cutoff of 6 months from adjuvant treatment to relapse was indicating a worse prognosis for our patients. In our results, we can see that patients who had relapsed within 6 months from the adjuvant had a significant lower survival than patients who had relapsed after 6 months. And this cutoff of 6 months relapse was also related significantly to the higher probability to receive a longer benefit from first-line chemotherapy. Patients who had relapsed after 12 months from the adjuvant treatment had a longer overall survival, which was 16.1 months in our population, and also a longer progression-free survival. The clinical significance, according to my opinion, is very relevant because in the MPACT phase 3 study, there were no patients who had received adjuvant treatment. So this data represent the first evidence that a rechallenge with gemcitabine after relapse, after adjuvant treatment, may have a positive impact on survival when gemcitabine is combined with the Nab-paclitaxel that may enhance the gemcitabine activity due to its mechanism of action, tumor stroma. And in the very next future, this observation will be very relevant also at the light of the future and immediate results of the APACT study with gemcitabine plus Nab-paclitaxel adjuvant treatment combination. And if this study will be positive, we should manage patients in metastatic setting who had relapsed maybe after gemcitabine plus Nab-paclitaxel adjuvant treatment. And in this case, the disease-free survival interval with a cutoff of 6 months would be an important weapon for oncologists to decide if re-challenge with Nab-paclitaxel plus gemcitabine also in the metastatic setting.